Welcome everyone to the California Department of Public Health Mpox Community-Based Organization Grant Request for Applications, or RFA, information session. We're going to give it 1 minute for folks to join before we start. Great. Hello, everyone. Welcome to the California Department of Public Health Mpox Community-Based Organizations Grant Request for Applications, or RFA, information session. My name is Eric Tang. My pronouns are he and him, and I'm a public health medical officer with the STD, or Sexually Transmitted Diseases Control Branch at the California Department of Public Health. I am the Mpox lead within the STD Control Branch, and serving to help support controlling Mpox and preventing Mpox in the state of California. So we can go to the next slide. Next slide, please. So just to go over some webinar logistics, this session is being recorded. The chat, video, and unmute buttons are currently disabled for this webinar. However, we are asking if you have any questions during the webinar or about the RFA, please use the question and answer or Q&A function of Zoom at the bottom of your screen so that we can keep track of questions. We will be answering these questions toward the end of the webinar today. Additional questions can also be emailed to stdlhjcontracts@cdph.ca.gov by Friday, November 17th at 5 p.m. So that's tomorrow at 5 p.m. And we will be addressing any questions that are submitted during the webinar and by that time to that email address, and posting answers to the questions that we can respond to by Tuesday, November 21st at 5 p.m. And they will be posted to the Mpox CBO RFA webpage, in addition to the session recording and slides that we will be going over today. Next slide. So first, to give some background about Mpox in California. So as I'm sure all of you know, the US and California experienced an outbreak of Mpox, or formerly known as monkeypox, which was declared a public health emergency. While the public health emergency for Mpox has since ended, Mpox cases are still occurring in California. And in fact, the California Department of Public Health, or CDPH, released a health advisory at the end of October, sharing that there has been an increase in Mpox cases in California. From February and August of this year, there was only an average of 1 to 7 cases per week, but beginning September 20th through October 10th, we saw an increase of about 17 cases per week. 15 counties in California had reported new cases in recent weeks compared to 11 counties in prior weeks. And we know that from wastewater surveillance data that there was Mpox virus detected throughout the state for the past several months, indicating that continued Mpox circulation in California is happening, including in areas where there haven't been any identified or reported infections. Next slide. So we know we have a great vaccine, the Jynneos vaccine, which has been shown to reduce the risk of severe illness and hospitalization, and thus additional efforts are needed to vaccinate populations most at risk for Mpox. People that are most at risk include gay, bisexual, and other men or sex with men, transgender or non-binary persons, people with HIV, African American and Black persons, and Latinx and Hispanic persons. We also know that a certain population, in particular African Americans and Latinx people, have been under-vaccinated compared to the burden of disease impacting their communities, and thus an important priority population to reach. Furthermore, the risk of severe disease is greater in people with HIV, and only, less than 30% of people with HIV have received at least one dose of Jynneos in California, and so there is much more work that needs to be done in this area. Testing for Mpox has also decreased since last year, but it's necessary to detect additional cases and provide education and treatment and linkage to care to people who are diagnosed to prevent further transmission. While the Mpox vaccine is effective at preventing illness and reducing disease severity, infections after vaccination are possible, and testing is warranted among vaccinated persons who have compatible signs and symptoms, which may be milder than unvaccinated persons. Next slide. So the purpose of the grant that we are presenting today is to fund eligible community-based organizations, or CBOs, for Mpox vaccine administration, vaccine outreach and education, and testing activities among communities at risk for Mpox. This grant can cover vaccine outreach and education efforts and uncompensated vaccine and testing administration incurred between January 1st of 2024 and June 30th of 2024. We define a community-based organization as a public or private nonprofit organization that provides services to individuals in the community. And federally qualified health centers and pharmacies can be considered a CBO if they are a nonprofit entity, which is defined as a tax-exempt organization under Section 501c3 of the Internal Revenue Code. Next slide. In terms of who is eligible, CBOs located in California are eligible to apply and must be in existence for a minimum of 3 years, be a nonprofit entity, again, defined as a tax-exempt organization under Section 501c3 of the Internal Revenue Code. They must be registered and have a status of good standing with the California Secretary of State. They must have the ability to track expenditures with detail and promptly invoice. And they must, that includes keeping the ability to keep and store expenditure records for a minimum of 3 years for state audits and reviews. They also must have the infrastructure to accept, store, and administer Jynneos vaccine. And they must administer doses into the California Immunization Registry, or CARE, during the grant period. And if your organization currently is not registered with CARE, the CBO must have a valid CARE org code, which is a unique immunization information system ID that is verifiable in CARE within 15 days of receiving an awardee letter. And then CBOs who are needing to onboard to CARE can visit the California Immunization Registry information website. Of note, hospitals, local health departments, and school districts are not eligible to apply for this grant. Next slide. In terms of application requirements, all required fields must be filled out. There are essential fields that are required to determine eligibility, scoring, or funding, which include the organization's legal name, contact information, and their county, entity type, asking if the entity is a CBO or nonprofit. It's also critical to include the employer identification number, or EIN, from the IRS indicating nonprofit status, and ensuring that you respond to questions about the ability to accept, store, and administer Jynneos. If your organization is already on CARE, you'll need to list CARE org codes for all sites planned to be funded through this grant. And you must submit all required items and cannot make any changes after submitting the application. And incomplete applications are considered ineligible. Next slide. So we have just over 2 million available to fund CBOs. All recipients of the grant will receive a base award of $40,000. There's additional supplemental funding depending on the priority population served. So this includes receiving an additional $10,000 for CBOs that serve greater than 50% of uninsured or Medi-Cal beneficiaries. An additional $5,000 of supplementary funds is available for CBOs that are serving a majority of Black, African American, or Latinx populations. And lastly, there's an additional $5,000 for CBOs that serve the majority of people living with HIV. So the maximum amount that CBO can receive is $60,000. If requests for funding exceed the $2.047 million amount, funding will be awarded to eligible applicants with the highest score based on the following criteria of population served, CBO size, and outreach activities. And more details of the questions and data used for that are included in the RFA PDF on our webpage. Next slide. So here are some examples of allowable expenses. All of them must be activities consistent with the purpose of the grant. So it can include staffing, so personnel who are directly involved in administering the Mpox vaccine or testing, outreach for staff to support outreach and education to the community or encouraging awareness and access to Mpox vaccination and testing. Can also support administrative overhead, including expenditures for general items that support operations in administering, supplying, or promoting Mpox vaccine and testing. This can also cover vaccination-related expenses, such as vaccine storage units, digital data loggers, staff training, IT-related modifications to electronic health records. Can cover Mpox testing supplies, including for shipping of specimens to lab for processing. Personal protective equipment, as well as STI prevention supplies, are allowed, as well as client education materials. And please note that this is not an exhaustive list, but all spending proposals must be submitted to and approved by CDPH prior to purchase and implementation. Next slide. So unallowable expenses under this grant include stuff we all get, which we call swag. So this includes the free promotional items for health promotion events, things like pens or mugs or t-shirts or posters, et cetera, that may be given out to at sort of fairs or other events. Individual prizes and high value incentives like iPads and iPhones are not an allowable expense that may be used for health promotion competitions. Cash incentives paid to the individual and scholarships paid to an individual or school on behalf of an individual are not allowable expenses. Food that might be used for a sponsored lunch or dinner at an event is not allowable. Construction, renovation, improvement, or repair of property, as well as any purchase of alcohol, tobacco, or cannabis are unallowable expenses. This is not an exhaustive list, and again, all spending proposals must be submitted to and approved by CDPH prior to purchase and implementation. Next slide. In terms of the deliverables for this grant, the grantees are expected to begin performance on these activities around January 1st or upon execution of the grant agreement, and the grant agreement will expire at June 30th, 2024. Grantees must submit a complete budget prior to activities being conducted, and activities being conducted without prior budget approval may not be eligible for reimbursement. Invoice payments will be mailed to awardees approximately 45 to 60 days after required information is submitted and verified, and sites will not be eligible for payment until they have a verifiable care or code. A final report will be required on outreach education activities, vaccines, and tests administered at the end of the grant period. This will include a description of outreach and education activities, including successful strategies, challenges encountered, and lessons learned. Vaccination data and this will all need to be submitted via the California Immunization Registry or CARE. And finally, testing data. So organizations will need to submit a total number of Mpox tests and number of positive tests performed during the funding period. Next slide. So this is our tentative RFA time schedule. So as I mentioned before, we are taking questions during this webinar as well as through the end of the week. Folks can submit questions to stdlhjcontracts@cdph.ca.gov by November 17th at 5 p.m. And we will collect those questions and respond in a publicly posted Q&A by November 21st by 5 p.m. And that will also include the recording to the session as well as the slides. We released the RFA on November 9th, and the application submission deadline is Tuesday, November 28th by 11:59 p.m. I'm emphasizing Tuesday because there was an email dissemination that stated Monday, November 28th, but the actual day of the week was wrong. And it is, in fact, Tuesday, November 28th by 11:59 p.m. in which the application submission deadline will be. We will post a notice of intent to award on our website, and that will be posted by November 30th at 5 p.m. And there will be an appeal deadline with details about how to appeal in the RFA PDF. And that deadline to appeal will be December 4th by 5 p.m. And as I mentioned before, the grant start date would be January 1st, 2024. Next slide. So this is our Mpox CBO Grant RFA homepage, which has an overview of the RFA and including links to supporting documents. If you click to the next slide. So this is the RFA PDF that has all the information that you need and details of the RFA, including the application eligibility criteria, requirements, and expectations for the grant. So make sure you take a close look at that before you apply. Next slide. The online application is a Qualtrics application. So this is the link. It is also on our webpage, and this is what you would complete for the application. Next slide. And we also have a grant application worksheet on our webpage. So you can use this to gather information needed ahead of time to complete your online application to see what kind of questions we're asking. But do not submit this worksheet to us. You need to be submitting the application through Qualtrics for your application to be considered. Next slide. And then here are some additional hyperlinks that might be helpful for the application process, including Mpox requirements at a glance that has been developed by our immunization branch. Next slide. So this is now time for the question and answer section of the webinar. As a reminder, the chat, video, and unmute buttons are disabled for this webinar, but you may submit any questions through the question and answer function of Zoom, which is at the bottom of your screen. Additional questions can be emailed to us, again, through stdlhjcontracts@cdph.ca.gov by Friday, November 17th at 5 p.m. And again, we will be posting the questions that are submitted to us by that time, as well as the questions from this webinar on our Mpox CBO RFA webpage. Plan to be posted by Tuesday, November 21st at 5 p.m. And again, make sure you review the RFA PDF for additional information and details. So with that, I am going to hand it off to Dr. Moore, who's going to help facilitate our question and answer section of today's information session.
Thank you, Eric. Hi, everybody. My name is Curtis Moore, Public Health Medical Officer in the STD Control Branch. Use the pronouns he and him. So one of the first questions we had is, can LHDs or local health departments apply for this funding opportunity?
Thanks, Curtis. Yes, so as stated on the RFA and previously in our slides, local health departments are unfortunately not able to apply for this grant. Neither are hospitals or school districts.
All right. A couple questions that are similar is, can pharmacies apply if they are for-profit?
No, they cannot apply if they are for-profit. Only non-profit pharmacies are eligible to apply.
What about a for-profit pharmacy who collaborates with a CBO?
Unfortunately, no. The organization itself has to be a nonprofit entity, or yes. So collaborations with a CBO would not count towards being eligible for this grant.
Another question is, if we are a CBO which does not have the ability to accept, store, and administer the vaccines, are we still eligible if we partner with a provider who does?
For this grant, you would not be eligible. It's for the purpose of this grant, we are expecting that the organization themselves have the ability to accept, store, and administer the Jynneos vaccine.
Okay. Will monkeypox or Jynneos vaccines and testing kits be provided to each CBO at no cost for this grant effort? And if yes, how will CBOs obtain these items?
So the vaccine itself is free of charge, and we obtain the vaccine from the National Strategic Stockpile uh, uh, that gets sent to us at the California Department of Public Health, and then we distribute that to the local health departments. And then those local health departments would work with us to make sure that the organizations that can accept, store, and administer the vaccine would receive the vaccine. So that the vaccine itself is something that we can get to if you already are not administering it or receiving it from your local health department. And in terms of testing and testing supplies, that is something we don't offer now, but could be used as part of the grant to be one of the allowable expenses to purchase testing or to or test kits as part of grants used or provided as part of this grant.
All right, thank you. This next one's a pretty good one. If we have specific questions, is there a way to speak to someone directly?
I don't know if maybe Carlo, if you want to answer that question, if you're on. So I guess I'll just go ahead and answer that question. Unfortunately, we can't answer direct questions and speak. The process is for us to make sure that any questions that are answered are available, and the answers to those questions are available to everyone to make this a fair process. So, but if you do have any questions, please submit them either in the Q&A here, or you can again, email them to the STD LHJ contracts at cdph.ca.gov, and then we will post those next week.
Great. Can California State University campuses apply for the grant?
That is a good question. I think we will take that one back and make sure that we answer that in our Q&A that is posted by next Tuesday.
Okay. Can applications be focused on outreach, or does each have to include vaccinations?
A major portion of this grant is to help support Mpox vaccination. You could technically spend the entire amount on outreach and education efforts if you wish, but you can use it for just for outreach and education activities if you want, but it is allowable to do it for both vaccine administration as well as testing administration.
Right. And coming from the same individual, if we co-locate vaccination providers at our site, can we use their care org code if we don't have one?
That is another question that we can take back with us and post on our Q&A next Tuesday. We are looking for the organization itself to, be the ones who are actually administering the vaccine, and so, but we can provide an official response posted on the Q&A next Tuesday.
And CBOs who have multiple centers in multiple counties apply for a grant award for each of their centers?
For this grant, no. Only if you're considered one organization, you may only apply once, and for the maximum amount of $60,000. However, you can have multiple sites be participating as part of this grant, and you would just want to make sure that any sites that you have plan to be participating in this grant, that you include the CARE org code in the application for all the sites that you would like to use these funds to support vaccination or testing efforts.
And just to add in here, you asked Carlo earlier, he's unable to unmute himself, so he will gather questions to make available for everyone. Just thought I would share that. If a CBO does not have a CARE number, can they still apply?
So you are able to apply if you do not currently have a CARE org code. However, you must have a CARE org code within 15 days of the date of the awardee letter. So that is something that if you're considering, if you should go to the California Immunization Registry information website to see how you can register for that. But that is something that we would want you all to do immediately if you don't, so that we can make sure that all funded organizations can ensure that they have the ability to vaccinate and report vaccine doses as soon as possible, since the grant period does start on January 1st and ends in June 30th of next year.
Right. We are currently an approved JYNNEOS provider from the previous Mpox grant through the county. We are a CBO. Are we eligible to apply for this grant? And if yes, how do we access the vaccines?
I'm sorry, can you repeat the question? I think I missed the first part.
They say they're currently an approved JYNNEOS provider from the previous Mpox grant through the county. They are a CBO. Are they eligible to apply for the grant? And if yes, how do they access the vaccines?
So I might have maybe some of the vaccine to add on anything I say, but you are eligible if you meet the eligibility criteria for this current grant. And if you're talking about the grant from last year, there were different eligibility requirements, but this does include having the ability to accept, store, and administer the JYNNEOS vaccine. But if funded for this opportunity, we would work with the local health department to ensure that you receive the vaccine to be able to administer it for this grant. And also, if you're interested in getting the vaccine in general, even outside of this grant, working with the local health department as well. And generally that, I don't know if that includes My California Vax, but I'm going to hand it over to the immunization team in case they have anything else to add about receiving JYNNEOS vaccine that I might have missed. Hopefully you can come off mute. I'm not sure if think we're having some problems with the text. So if there's anything else to add to that, we'll make sure to post that answer in the Q&A that we will post on our webpage by Tuesday next week. Sorry about that. And I think we could, actually, let me see.
We are at 5.
Oh, thanks. So we have run out of time. I don't know if there's many more questions, Curtis, but we will, like I mentioned before, we'll take all these questions and be reviewing them. We'll post answers to what we can by next Tuesday, November 21st by 5 p.m. that day. And if there are any additional questions that were not included in the Q&A today, please email them to stdlhjcontracts@cdph.ca.gov by Friday at 5 p.m. And then we will include in our review and post those answers on our webpage by Tuesday at 5 p.m. Thank you, everyone. Appreciate your interest in this grant, and thank you for our participation today. Thank you.